welcome today to this special webinar in association with Water for People and their partners in Rwanda. We are going in a slightly different direction than normal. We're stepping out of the rural water silo to peek over the hedge into the world of market-based sanitation, which is very exciting because I think market-based approaches are something that we have as part of our self-supply theme in the rural water supply network, but I think there's a lot that we can learn from what our colleagues on the sanitation side are doing. My name's Sean Fury. I should have introduced myself at the top, but I'm the director of the Rural Water Supply Secretariat based at SCAT Foundation here in Switzerland. And we will start today's proceedings with a short animated video followed by two presentations by the project team in Rwanda, and then we're going to have a bit of a discussion followed by Q&A and closing remarks. So let us go to the video.
In Rwanda, rural household motivation to invest in sanitation is low. Other needs are prioritized. Research shows this is caused by weak hygiene interventions, ineffective social norm promotion, unaffordable sanitation products, fragmented supply chains, and inconsistent marketing. Isoko y'ubuzima aimed to change this. The traditional approach has focused only on raising awareness in communities. By combining a market-based approach with insights into the drivers of human behavior, the project tackled the challenge differently by demonstrating that households can invest without the need for any subsidies. The project combined three key pillars of activity anchored in strong district local government support. To create demand, households were approached with different marketing messaging aligned to 5 adopter groups, from innovators to laggards. Nearly 2,000 community agents, including health workers, youth leaders, and people with disabilities, were mobilized and trained to engage these groups through household visits, along with product fairs and radio, to encourage behavior change and support sanitation product sales. To improve access to sanitation products, Isoko y'ubuzima supported district sanitation centers in each of the 10 districts and over 100 community sanitation showrooms to offer standardized low-cost sanitation products. Sales agents were trained to support sales using the decision intelligent selling technique. Masons were trained to support product installation, improving access to products. To support household investment in improved sanitation, the project leveraged village savings and loan associations, VSLAs, and microfinance institutions to facilitate access to financing. Households set sanitation goals and used loan products, savings mechanisms, peer learning, and group accountability to accelerate their progress. Access to finance through VSLAs and co-creation of desired products helped households fulfill their sanitation goals. Combined action across all three pillars, anchored in strong district local government support, has driven a tenfold increase in families achieving improved sanitation. To date, the project has facilitated the sale of over 26,000 SATO sanitation products, helping over 120,000 people access improved sanitation without the need for any subsidies. Isoko y'ubuzima offered an evidence-based approach to advancing sanitation in rural Rwanda, and it's working. By combining insights into the drivers of human behavior, market systems, financing, and supported by an enabling environment, this market-based sanitation approach empowers citizens to invest in their financial resilience, health, and dignity.
Fantastic. So that was, I think, a very good introduction to today's topic and what we're going to be exploring in more depth now. And I'm really interested to learn more. the good news is that the chat box is now working, as some of you have worked out. So thank you very much for your patience for that one. But now it's my absolutely delighted to introduce our first speaker, Bruce Owankunda, who's the chief of party of this project, which is a US government WASH project implemented in Rwanda. He's over 16 years of experience in WASH and environmental management with a strong track record in project leadership, sector coordination, and institutional capacity strengthening. Since joining Water for People in 2015 as a senior program officer and later serving as a WASH sustainability manager in 2017, he supported district level capacity building to improve the delivery of sustainable WASH services. In his current role, he provides overall leadership and coordination of the project interventions while maintaining overall leadership within the WASH sector and fosters a positive professional working relationship. So, Bruce, please over to you, sir, and introduce us to the topic in a bit more detail.
Thank you, Sean, and thanks to the Water Supply Network. Good afternoon, good morning, or good evening, depending on where you are. It is a pleasure for the Isoko Ubuzima project team to present to you our experience and our journey through the market-based approach. Before we do that, I would like maybe to give you an overview of the project. Next slide, please. So the Isoko Ubuzima project, as you've seen in the video and as Sean mentioned, it's a US government-funded project with a budget of 22 million from the US government and 2.3 million as cost share from the implementers. It's a 5-year project, started in July 2021, and we are actually reaching the end of the project implementation, and that's why we are happy to share with the rest of the world some of the things we have achieved. Our line ministry in Rwanda is the Ministry of Infrastructure, which is the ministry in charge of all infrastructure development, among others, water and sanitation infrastructure. We worked through 3 strategic objectives at the beginning: improving WASH governance, improving drinking water services, improving sanitation and hygiene product and services. But in 2024, when there was a Marburg virus outbreak in the country, the US government gave us an additional funding to support the government of Rwanda into Marburg virus disease WASH response plan. In the video you saw, we started with 10 districts, but after the Marburg virus WASH response plan additional funding, we expanded our intervention in 5 additional districts, and we have presence in 15 districts. So we work through with the government of Rwanda, but we have consortium members. Water for People is the prime, but we also have CARE International that you will hear in this presentation. We also have IRC, VEI, and AEE, and I'm happy I saw in the chat and the list of participants some colleagues and partners from those organizations. Next. Over the last 5 years, next please. So I would like maybe just to give you a highlight, an overview of what we have achieved. We have developed investment plan that will help the 10 districts to mobilize additional funding. We have trained and built the capacity of various professionals, over 500 plus. We have supplied clean drinking water to over 369,000 people. We have worked with the private operator and the national utility to reduce non-revenue water, and we piloted our interventions on 10 selected water supply systems, and we have recorded an average of 30%. There's a typing mistake. It's 30% non-revenue water reduction. And above all, and this is the focus of this presentation, over 119,000 people improved or constructed their latrine without any support, rather from our interventions and our messaging. From their willing and from their own resources, they have constructed new toilet, and we want to share this success with you. Under the Marburg virus, we've supported providing permanent water supply services to 9 healthcare facilities, and we've supported intra-facility connection, water connection. That means bringing water close to the area of treatment in healthcare facilities. So without further ado, I would like to pass to my colleague, and I'm going to tell you a journey on how these 119,000 people have improved their toilet within a short period. Over to my colleague, Sam and Nikes, Sean, I think you are going to introduce them.
Yeah, absolutely. Fantastic. Thank you for that introduction. So now we have a joint presentation with two of the key people from the project. We have Marina Keza Ugabinama, who's a project manager with Care International, leading this project from their side, and she's a WASH and public health specialist with nearly 20 years experience in designing, managing and scaling public health, sanitation, hygiene programs. And then we have Sam Naholi, is a private sector development advisor with over 15 years experience in the WASH sector. He currently serves with Water for People Rwanda and this project where he leads initiatives to strengthen private sector engagement, public-private partnerships, and entrepreneurship. So over to you and take us through the detail.
Yeah, thank you very much, Sean, and welcome everyone. Today we are very excited to share with you our journey and our experience around market-based sanitation. In this session, we'll be talking about how we designed the market-based strategy, what we learned from the implementation to date, but more importantly, we're gonna talk about what makes this strategy successful. In the next slide, we will give you an overview about our assessment and findings. When we started this project, one thing was clear from our side. We knew that existing approaches are leading to sanitation outcomes in a positive way, but we will still notice some challenge about the sustainability of outcomes. In our mind, we said we need to do something that is durable and sustainable. And at the beginning, we wanted to understand what are the challenges and what can be addressed. And we conducted 2 assignments. One assignment was to understand how the hygiene and sanitation marketing mechanism works here in Rwanda. And then we also wanted to learn about sanitation business viabilities in Rwanda. What we realized is that the existing programs, were leading to increasing awareness, but people still didn't opt or upgrade their toilets as expected. Certain households were dissatisfied, but stuck with the poor quality of toilets, especially in rural places. Supply chain were broken, products were not everywhere, and service were limited and fragmented. The purchasing power was a major concern. People were not aware of how to get finance and where. And also, we noticed a certain concern with women who have the primary responsibility of improving sanitation, hygiene, and household. But when it comes to financial decision making, they were powerless. So we said with the insight from the market-based assessments that we need to design a good strategy addressing those issues. In the next slide, we designed the strategy. As you saw in the animated video, the market-based strategy was having 3 pillars, the demand activation, the supply chain strengthening, financing mechanism. But this was not everything because it didn't give us direct actionable interventions. That's why we broke down the pillars into 5 components. The first component was also demand activation. Second was about supply chain strengthening. And we aimed to also reinforce our financing mechanism. And we had 2 cross-cutting, can say, subcomponents. One was district or local leaders capacity building. And also we wanted to ensure that no one is left behind. That's why also we had a component about specific needs addressed. For most of us in the WASH sector, this seems to be normal. The only game changer we're having in mind that we introduced was to ensure the proper integration of the components and to ensure that those components works together. Yeah, in the next slide, we're gonna take you through in each component and how we designed each component and we actually implemented it. For the demand creation, we made sure that we are shifting from awareness campaigns to behavior-driven engagement. We specifically set behavior to be achieved under the community and especially at the household level. And to do this, we make sure that we are using existing community structure, but we help them with trainings and skills to become social behavior change around sanitation and hygiene because they were from different sectors and areas of expertise. And we made sure that we are expanding our education from the awareness to behavior change, as I said. We made sure that our intervention are community-led to build strong and sustainable structure. We made sure that we are creating social influence that address behavior. As we see the nice flower on this slide, it's a petal that we use to show or to qualify household that met or adopted the desired behavior. That's created kind of social cohesion, social influence, where everyone was fighting to adopt those behavior to be recognized, and other households were copying from one another. We made sure that whoever has the knowledge is also linked to professionalized suppliers to make sure that they're fulfilling their demand. To engage people, we mainly used interpersonal communication than mass communication. We knew that people don't change behavior because of message, but that they change due to trusted interaction and strong engagement with them. In the next slide, we're going to talk about the supply. And the one thing we learned is that raising awareness or creating demand without supply only creates frustration, not adoption. We try to make sure that the whole supply chain is reinforced from the national level. The manufacturer or the importers have enough materials and product to be distributed at the district level, which is like the second layer of our government structure, and where we established what we call community district sanitation centers. And down we established what we called community showroom, and at household level, we had sales agent doing sales to every household. What's more important, as I said, all the district sanitation center and community showrooms were established from already existing private sector people. We didn't bring new people to be trained, but we work with the private sector federation to avail people, and community showrooms we linked with people who are already in business, existing shops, and we only requested them to have a corner for sanitation product. So we didn't create a new system, we strengthened already the existing one. We used also the human-centered approach to re-engineer and to design the appropriate and the human designed or the product that are designed and inspired by the community wishes. To sell the product, in the next slide, we came up with an idea of not just doing the marketing alone, but actually leading people to take informed decision about the sale. The DK sell or decision question cells is one of the techniques we used. We hired a consultant, a written law consultant, who designed this approach and bring the expertise to adjust how we're looking our market. At the beginning, we did a study to see where the market was struggling, and we tried to address this. We saw that there were a low incentive for people doing the sale, and the sale commission was introduced at 1,000 Rwanda francs per product, but the amount could change based on type of product. We introduced specific team dedicated to sales management, which was not existing. We introduced also a product-based sale. We used to have a product-based sale, but we shifted to problem-based sale. Instead of showing all your products, we tried to sell what problem will the product address. We were having too many products at a go, but we thought our sales agent to focus on one type of product and then switch to a new type of product whenever the market is satisfied. We also opted for we used to have a large sales force where we had more than 2,000 people doing the sales at a go, but we tried to reduce to a smaller group, but which was more effective. We had a group of 150 sales agents in 10 districts who did an amazing job in terms of selling our product because we're able to manage the sale and coaching them effectively. The professionalization of our selling technique turned the business of sanitation into a viable market activity, and sales agents were only passionate to sell with the project, but also to even use the similar technique to sell sanitation hygiene products beyond the project. And in the next slide, we want to show you that households don't take decision to purchase just directly. It's not from awareness or conversation to decision making, but households will learn that they pass through a series of decision making. They move from the stage of awareness, where we give clear information about the problem, the cause of diseases, etc. And then we create them with a desire of having something better, something new, something that's lead to improved economic development. And then after awareness raising, we have a kind of conversation where we talk about the fear that people have about having an improved latrine or not improved the latrines. And then we go to build the confidence to act. We show them with clear examples of how their colleagues, their community members also addressed their fear and came up with opting for improved latrines. And then we go to decision making where we have a personalized option based on the conversation you have. Then we can get someone about where and how we can get the capacity, the service to upgrade the toilet. And we give the option for financial access and having finance to purchase required product. And the next phase where they actually purchase and they are linked to community services support who can provide either technical or service to upgrade their toilets. And then we saw them moving then to the actual installation of toilets, proper use and maintenance. And this cycle coming, we saw people when they reached the level of improved access to basic toilet, they start thinking about how then to do transport, how to reach the safely managed level, and they are taken through the same process. So the pathway showed that the sanitation process goes through a number of series. Instead of thinking just from awareness, someone will install and then upgrade the toilet. So without further ado, I will invite my colleague Sam to take you into the next component of our strategy. Thank you.
Thank you very much, Nikes. Good morning, good afternoon, good evening, everyone, wherever you are. As my colleague Nikes has taken you through the key pillars of the MBS strategies, Now I'm going to talk about, to focus more on the financing. As I'm the private sector development advisor, I worked in this project just to support the private sector, especially in the financing. How can the private sector get access to finance? Nikeza has talked about the key issue. One of the issues found during the assessment, there was lack or limited access to finance, limited capital investment for sanitation private entrepreneurs, and even lack of finance for households who want to improve their sanitation facilities. So one of the deliverables or the responsibility for this project was to facilitate this access to finance, to see mechanism how a household can improve their toilet using their own money, because we are not, the project was not intended to donate free installations. And also for the sanitation operators who are working on this, how can they access to finance so that they can expand their businesses. So as you can see on your left on this slide, the first entry point for this financing was the VSLAs. VSLAs here I mean Village Saving and Lending Associations. These are a group of people that put together to save a small amount of money on a regular basis, so that they can, during the share out, they can do something tangible for their social and economic benefits. So as Kea is expert in this, in setting or creating these VSLAs, so it was NIS entry 20 for this. So these VSLAs, we have worked with more than 17,000 village saving groups scattered into all villages of the 10 districts that we are working in. So why are we working with the VSLAs? First, these are the influencers of other community members. So in Rwanda, most of community members are adult people more than 18 years and above. Most of them, they are members of these VSLAs. So we have worked with them. We train them on financial literacy. How they can save with the purpose. So in this case now, they had three options. Either they save for the household sanitation so that they can build and improve their train, or if they don't save, if they can also get a loan, small loans in those VSLAs, just to build their or to improve their trains. That was the first part where how they can improve, they can access to finance. Another line was, if maybe this VSLA does not have enough money, they had also another option to go and take a group loan now to microfinance institutions, so that they can improve their latrine. But most of them, they did not go for this group loan to MFIs because of the high interest rate, which ranges from 1.5 to 2% per month, which is almost 24% per annum. So most of them, they opted for the two first options. Either they save for sanitation, or they get loans, proper loans for sanitation. So maybe something I can mention is that in some of these VSLAs, when a member wants to have a loan, to take a loan for sanitation, they give him or her a loan with free interest, so without interest rate. So that's one way to access to finance. Another way to access to finance was for the institutions or businesses, sanitation businesses. On your right, you can see a picture of, this was in June last year, when Water for People in Isoko Ubuzima worked together with UNICEF and the largest bank of Rwanda, Bank of Kigali, to launch now a specific tailored wash loan product for sanitation and water private entrepreneurs who want to expand their businesses, whether they want to build some water system networks, or for sanitation, those who want to purchase trucks for pit emptying, or for district sanitation center that want to expand their businesses to sell sanitation products and sanitation and hygiene products. So far, we have the bank, according to the recent report, has provided about four to five loans equivalent to 400,000 USD. These are big loans where each one gets around more than 100,000 USD, especially to purchase these vacuum trucks. So I think this is a good options for this project. And for the VSLAs, I know that as we will see on other slides, that so many people have improved their latrines using either their own means or using this saving and lending associations. Next slide, please. So not only the three pillars of the MBS have revolutionized this project, but also this thanks to a good collaboration with the local authorities. Here I mean from the design to the implementation of this Isoko Using project, especially the MBS strategy. We have been working closely hand in hand with the local government and the national government. By national government, I can mention that training on MBS strategy, market-based sanitation, rather has we have trained different ministries, including the Ministry of Local Government, the Ministry of Health, the Ministry of Infrastructure, which is our direct line ministry, and WASAC, which is the Water and Sanitation Corporation, which is in charge of water and sanitation both in the urban and rural area in Rwanda. So far, whatever we do, we are in collaboration with all those institutions, and that is at the national level. But also, we work with the local government, that is at the district level. That's why whatever we are doing, we have trained staff from the district level, especially in charge of sanitation and hygiene, to make sure that the MBS is known and is implemented at the district level in the community. So another thing maybe I can add on this is that wherever we are going to start the project is starting the planning for the fiscal year. We organize what we call the joint reflection meetings, where we sit with the government institutions at both at the national level and the local local level. Then we reflect, we do reflection on the past year. We discuss on what went well and what went wrong. We discuss on the challenges we met, and then we plan now for the activities for the next fiscal year, which is, I think, a good collaboration. So we have, as Nikes has said, we have established together the social behavior change and communication agents, the DUC sanitation center operators in the supply chain and the showrooms. All this we do it with the government. What we do is just to facilitate, but the owner, the agents, the operators, all those are given by the private sector and the local government. So what we do, we just sign MOU for that, but it is done. It is a tripartite joint activity between the project, the local government, and the private sector. So with the joint monitoring, whatever we do, we conduct. We have to collect the data, and this data, when we are conducting data or when we are doing monitoring, we make sure that we include local government or local institutions. For instance, if our field officers are on field doing the DQA activities, they make sure that they go with local government activities in that area to testify the activity on the field, and also to approve data, to make sure that data collected from the field are real. Next, please. Yeah, as it, special needs addressed, as you know, the project Isoko Yuzima did not want to leave any behind. That's why you have to make sure that we are addressing, we tried to address issues with all layers of the communities. So with this special needs, we formed the Women Empowerment Framework, where we have to build agency. This is especially focusing on the empowering people, especially women in the area, to make sure that we strengthen their voice, that we leave or we remove all the social barriers in the area, to make sure that women can take decisions on the about the sanitation and the hygiene matters. We know that sanitation affects everybody, but affects much women and children. That's why in this project we made sure that women are empowered to make sure that they decide. So as you can see here, these are toilets for people with disabilities, especially with the disabilities, but which are made locally and which can be afforded with not too much cost compared to other ceramic toilets for people with disabilities. So this is how we are trying. We're trying to promote participation in the household and the community decision making and foster everyone engagement on social acceptance. Thank you. Next. So this is one example of the achievement of the Isoko Yuzma project. Especially here, we want to mention the sales for household sanitation improvement. As you can see, I don't know if everyone can see this graph. As you can see, when the project started in the fiscal year 2022 up to 2024, sorry, yes, up to 2023, you can see the cumulative SATO pans. This is just an example of one of the sanitation products we made, but we have promoted a number of these sanitation products, but this is one of the examples. As you can see from the starting of the project in the fiscal year 2022 up to fiscal year 2023, quarter three, or yes, quarter three, you can see the in the green, this is the cumulative Satopan sales. For those who are not much, Satopan are just products that are put on toilet to improve their usability and for safety. So we had around 537 cumulative Sato sold and 4,000. Sorry, I'm just okay. Yeah, you can see how numbers were at low level until the fiscal year 2024 quarter three. That's when they started now increasing. This was thanks to the professionalization and the training from the Witten and the Roy that Nikes mentioned that professionalized our sales agent and our district sanitation center operators. And since then, you can see how now the numbers are increasing. So far, we have achieved the current numbers. We have achieved 28,000. If you can see, you can look at your right side. We have achieved 28,171 Sato sales with the 24 close to 25,000 toilets improved. So this difference is defined by that. Some of the buyers of these products are institutions, and this project is focusing on households, so we didn't monitor the installation of toilets in the institutions. So that's why. But so far, with the 24 close to 25,000 improved latrines, we have overachieved our target, the project target, which was for 100,000 people gaining access to basic sanitation. You can see that we have achieved now 119%, which is something to be proud of. Next, please. Next. I don't know if yes, yeah, okay. Thank you. Now to close, these are the something that we learned, the key success or key learned lessons learned from the project, especially on for the sustainable market-based sanitation. One success factor or lessons learned is about working with the government. So the government, as I said, that we co-designed and aligned with the national strategy. So whatever the project, whatever we did, we were collaborating with the government from the designing of the project on the field to the implementation. So working with the government is the first key factor that led us to all the achievement. And another thing I can say is that working the government does not mean working with the government from the start and close the project. I think the reason behind and what we are proud of is that after after working together, we believe that the government will continue to take the MBS strategy in their hand for ownership and sustainability. So we have this belief. The second is about the strong market, which need the private sector mindset. So bringing the private sector expertise into our strategy from the design up to the implementation, professionalizing or capacity building for all the supply chain actors. The same will has led the project to achieve what we have achieved, as I mentioned. And also we have that strong belief that with the existing now, the MBS strategy that we have developed, we are now sure that even the project when it closes out, but the market-based sanitation will continue to be implemented by the government and by the private sector through all these structures that we have set up together with the private sector and the government. So the third success factor or lesson learned is about the adaptive management driver success. As I mentioned earlier on the other graph of sales, as you saw, we started with less achievement, but later we learned that something is wrong, it's not working. So what we did, we hired the WRP, so to come and assess what is not going on well and how can we adjust and now achieve the result. So all these adjustments drive to success. So that's why in whatever we're working with the project, we don't just get on at the same pace. We have to check, we have to, we had to stop, reflect, and see what other new measures that we can apply so that we can achieve good results. Next. So another key success factor is about women. Women, by building the agency, the change relations, by empowering women, we found out that women are key drivers for the success of sanitation, adoption, and influence. As I said earlier, that women are the most affected, but also they are the most to catch or to understand and implement sanitation initiatives. So with this project, I'm sure that like the entry point I talked about, the VSLAs, 70% of them, they are women, while 30% are men. Even for the private sector, it's like 50-50. They are almost equal number of women and men in the sector. I can mention a district sanitation center operators who have women, and something new that maybe I want to share with you is that when we were training masons for the improvement for the construction of latrine, we were surprised to see women masons, which is a good factor. So strengthen the existing structure. Yes, that's another also good success factor or lessons learned, that the project did not build parallel structures, but we build on existing structures to make sure that we strengthen the existing, and which also contributed to faster results yeah, for the first results. So I think this is, unless I have another slide, but no, this is the. So thank you for this time given to me to present. I think I can give back now the floor to Brice for conclusive words. Thank you.
Yeah, thank you, Sam. And yeah, I would like to share some additional resources to participants so that we can get to know more about our intervention. These are some of the products that we have produced, and you can scan those QR codes to get access. Maybe Sean or Alina will maybe request that we leave them at the end of the presentation so that people can scan them. But maybe to gain on time, if we can go to the next slide, and before I conclude, Water for People and the government of Rwanda, and African Union through AMCAO are organizing an Africa Water and Sanitation System Leadership Symposium in August from 16 to 21st August in Kigali, Rwanda. We are also happy to share this QR code to invite people to register and welcome you and invite you to Kigali to attend this conference. And this is going to be an interesting conference, and you'll be able to learn more about water sanitation, especially on country snapshots and system leadership. Before I conclude, we want to maybe have some concluding remark by thanking each and everyone, thanking my colleagues, but also thanking my other team members who could not maybe speak. We were only the three of us, but there's a big team behind us, and we even have some people helping us to respond in the chat. But this was a team's effort and a collaboration between different organizations. But we all agree on something. If we want universal access to sanitation, we need to move beyond awareness campaign, because sometimes awareness campaigns do not work. We need to move from a business aspect, and market-based sanitation is one of the good approach. So we have built the systems and we have built the mechanism. However, we think it is good that people start working through people by implementing market-based sanitation, but also, as Sam mentioned, working closely with government and local leaders. So without further ado, thank you, and we welcome your question and answer. Over to you, Sean and Aline.
Great. Well, thank you, team, for a really wonderful presentation. So much there. We've got a time to take a few question and answers, and it's great to see that already in the Q&A box there's a lot of activity, a lot of interest. I mean, for me, I think one of the things that I take away from this is just the systematic approach that you guys have taken of really looking at the system, looking at the customer journey, looking at it from the different perspectives of and the roles. What's the role of government in providing that enabling environment? What's the role of finance, for whether it's the household end of the finance or the enterprise end of the finance piece, and just trying to line up all the ducks in terms of getting the supply chain, the demand there at all the different levels, but then the means to fulfill that demand on the supply chain, and some of the decisions and adaptations that you made along the way, in terms of like, okay, we need to beef up this bit. We've got too many people here. Let's reduce that. Really good. And I think there's a lot of lessons here that, although they have been used in terms of household sanitation, really apply to a whole load of other things. Maybe what's specific to sanitation, though, I think is one of the things that I picked up on was that a toilet is never going to be a desirable product. It just isn't. People don't go, I really want to buy a toilet today. No, it's never going to happen. But what people do have is a problem if they don't have a toilet. And so I think that pivot from selling a product to sales around a problem, I think just shows that you have to kind of really understand how to frame the issue in order to make it work. Okay, so we've got a couple of inputs to come, but just a couple of questions before we get to there. So Digbijoy asks, can you further explain the point, too many products, focus on one product? How do you decide which product to focus on? And from Jim, same question, do you not keep options for different costs to meet different financial situations? So who would like to take that?
In case you want to take the products, prioritizing products, many products versus focused products.
Yes, thank you, Sean, for the question. We at the beginning we were having the whole market with various type and prototype of sanitation, but community members were confused, and even the sales agent, it was difficult them to master each and every types of product at the market for better selling. So then we started with product that is easy to carry and easy to install to be installed by masons, which was saddle pans. So we were kind of taking one prototype of product, sell it until we see the market is satisfied, and then we go to another product. And we are taking like a period selling one type of product, and then we move to the next type of a product. The same for the district sanitation centers. Our advice was to take time by marketing a certain type of toilet prototype, and then go to another type of toilet prototype. What we didn't want was to display everything at a go, because community members get confused and they don't got really enough time to engage about and to have a conversation about many products that you show them at once. So we saw that was a good strategy to go slowly but with high intensity. Being focused was a game changer than having everything at a go, because sanitation is not a domain that everyone is conversant with. So exposing them to many things at a go seems to be confusing than bringing to decision making. Over.
Great. So I think, yeah, so there's the second part of that question, which I think is related, is the different price points or different costs. So is that a similar situation that if you have too many options, it just creates confusion? But then how do you balance that against equity about some people may have more willingness or ability to pay for a product than others?
Yeah, some will also complement, but as I said, we sell through a conversation, and people are the one to, during the conversation, they can, for instance, say, I would like to upgrade my toilet, and I'm having like financial limitation. The first solution is to give them, based on the context, based on the soil character of your area, this will be the best option. Can you first try and see if you can get the financial from here and there? We show them the different option. If you insist and say no, we say, okay, there are other cheaper option, but these are advantage and disadvantages. We do present those options as well, but we also show the disadvantages, because some community may need or may look for cheaper option, but the durability is an issue. And at long, when you saw the financials or money injected in maintenance or upgrades, renovation, it's higher than installing a strong and context-specific toilet. So as much as we want to give to people cheaper options, but also we look at the sustainability and overall maintenance cost, which might be higher to the actual cost of one durable context-specific product.
Fantastic. Great.
You are
So,
muted, Sean.
oh, uh, uh,
We can hear you, Sean. We can hear
oh,
you.
yeah, I'm not muted. Okay. Yeah, so the next question, which is the most upvoted from Ivan Noe, is could you please tell us how many latrines have actually been financed or paid for through microcredit mechanisms under the project? Also, on what basis did the microfinance institutions agree to create sanitation-specific financial products, and what are the conditions? We would appreciate more details on these financial products, including the interest rates, repayment terms, eligibility, and guarantees. So asking for quite a lot there. So, so as much as you feel that you can, explain.
Do you want to take that one?
Yeah, let me go first. Um, Okay, thank you. I tried to answer in the chat the question. It's a good question, and thank you for asking this. As I explained, what we learned is that most of the people, well, especially for consumer parts, some will be talking about entrepreneurs loans, but for consumers parts, most of the household don't first go for the microfinance or even saving groups loan. They prefer to use saving to install and upgrade their toilets. From the study we conducted, only 3.6% of households prefer to use sanitation loan to upgrade their toilets, while the rest don't really think about it. And we found this positive because the loan come with a certain interest rate that we also don't want household to go for unless it's a really very, very important. What we promote is first saving with a purpose and then upgrade slowly. But when it's really necessary, we encourage people to go to saving loan to saving loan because within the group they have their own loan and the interest rate is very small. It's between 4 to 6%. But when it comes to a group loan, they are also with the engagement we had with the Association for Microfinance Institution in Rwanda, we agree with them that they can create what we group a group loan. It's not actually a specific group, a specific loan for only sanitation, but it's a loan that combines three things. It's loan that VSLO saving groups can use for household sanitation, for economic development, and from agriculture. So it combines those three options. When a VSLA wants such type of loan, they compile their needs. There's a group maybe of 10 people who want a loan for agriculture, 3 who want for sanitation, and 5. And then they put together the amount required to go at the microfinance. They get a global, like a total amount of loan that they divide between themselves based on their needs. And then they pay back also as a group. So the question also, I don't remember the name, apologies, asked, the loan is given, one of the conditions is given to VSLA who has, who the VSLA that have the account at that specific microfinance institution. That's a condition. And they don't request a kind of collateral payment because the association of the saving group accounts, which have all amount or the money saved into a microfinance institution, serve as a collateral. Second, in terms of, also they asked in terms of the payment condition, the repayment is on a monthly basis, and it's based on, they normally give that loan to be paid into the cycle of 6 months. So they have to take a loan that they're capable to repay within 6 months, because VSL have a cycle of 12 months at 12 months. So they normally take like 3 months to save, and then 3 months to engage with microfinance institutions, and 6 months for repayment. So that's on the side of the consumer, because the conditions for entrepreneurs who normally get their loan from banks differ. So I pass to Sam also to talk about loans of entrepreneurs from from commercial banks.
Yes, thank you, Nikes. Briefly, this loan, we designed this loan together with the UNICEF. First of all, we contacted the bank, commercial bank, to discuss if they have knowledge about the WASH. So most of them had poor knowledge on water and sanitation. They thought water and sanitation is a social benefit. It's not a business. But after discussing, then they discovered that there is a business opportunity in the WASH. So we developed a WASH loan product with the current interest rate ranging between 10 and 14% per annum or per year. So the requirements, I think I cannot mention all the requirements. You have to be first a business entrepreneur, being registered in Rwanda Development Board with a lot of all those requirements with some experience. But I think 6 months to 1 year experience in business and sanitation. And so the guarantee, the bank can just cover 50% of the guarantee, and the entrepreneur will cover the remaining. So far, private entrepreneurs are very excited to have this loan. As I said, that so far they have taken a loan equivalent to 400,000 USD. Now we have around 700,000 USD of loan requests in the pipeline. So you can see that since June 2025, just in 1 year, that around 12 private entrepreneurs now are willing to take the loan. So if we want more details, maybe I can share a link with the Bank of Kigali for more details. Thank you.
Great, fantastic, thank you. Okay, so now we just please do keep on asking questions. The Water for People team are in the background busily answering as many as possible. But we'd like to hear from two more people today. So the first is Charles Ruisha, from Local Government Inspection Specialist from the Ministry of Local Government. And the second is Leon Pierre Rusangawangwa, who is a health program coordinator from the Private Sector Federation in Rwanda. So Charles, please, over to you.
Charles, you are muted.
Yep, please go ahead.
Charles is muted.
Yeah.
Do you hear me?
Yeah, please go ahead.
Yeah. Normally, the Minister of Local Government coordinates the performance of local government, where local government implementing all government programs. Relating to hygiene sanitation, there is some support government provided. First, there is what we call financial services that code for vulnerable people. That is used to vulnerable people to support them when they take that small loan. They may build the toilet. For them, it's like for social support, and some of them, when they took that money, they build the toilet. The another one is awareness campaign for the hygiene and sanitation. Mostly, we take a quarterly campaign on hygiene and sanitation, and the people are mobilized on the importance of hygiene and sanitation. Then they took decision to improve their livelihood and to improve their hygiene. For us, we don't only took the hygiene and sanitation, because we even see on public places how to improve for the government building, how to improve their hygiene. There, all of us, we conduct regular inspection, and we have also formed the district inspection team in order to enhance mobilization and quality compliance of IGN. The third thing is the performance of district sanitation center. In nowadays, you have tens. Those tens are performing, some are performing well and are performing in the middle. But we've in partnership with Rwanda for People and the Ministry of Infrastructure, we have discussed how may be scaled up in the other district. Then in that ways, it will support another district also to get the hygiene sanitation product. Then the people closest to community, they may get job in selling, and then the other will be used in improving the livelihood. I think that's what related to what Minister of Rural Government doing related to hygiene sanitation. Thank you.
Fantastic. It's a great partnership, and it clearly is working really well. Leon Pierre, over to you, sir.
Thank you so much for the good presentation from our colleagues who presented before. The Private Sector Federation was very glad to be part of this project alongside the partnership between the tripartite, the civil society. So, we are introducing this new approach, which is for our market-based sanitation. It is a new approach in the world, but also we rely on it in terms of sustainability. It involved much behavior change amongst the community, combining social areas and economic factors like access to finance through VSLAs that we support so much, and that we advocated for being official, that community members of communities can borrow money from VSLAs, and this was official by the Ministry of Finance. So around the country, PSF or Private Sector Federation has trained the staff at district level that can provide the technical support, and also these staff and committees are amongst the JAF at the level of district, and the chairperson of private sector is amongst the member of council at the district level. This is informing us the importance of sanitation, market-based sanitation approach or strategy in all districts, because the private sector of Rwanda owns 94%, around 94% of the total labor market. And the member of the household, they are themselves that are working for private companies. Here we are relying on the sustainability of Isoko USIMA program, where we need to achieve more about the SDG number 6, water and sanitation, safe water and sanitation, so that our staff can be safe and the private sector can reduce the expenditure on obstetrics and also the medical treatment. Because in the training, we learned more about the cost of the problem of not solving the sanitation issues, that the private sector is going to lose experienced personnel because of bad sanitation at home. But now the private sector has already assessed the direct costs on non-compliance at the household level, and also the revenue generation and the brand resistance. So, and it brings us the economic and operational benefits in terms of workforce productivity, supply chain, and security, and also the commercial market expansion, so that the district sanitation centers can generate revenue for the private sector, and also the private sector distributing sanitation materials to households. So thank you so much for the time I was dedicated for.
Yeah, brilliant. Thank you. Thank you, Leon-Pierre. That's really good. And I think what we've heard today is, I think, to set this in a slightly bigger picture of a lot of talk around the role of the private sector and how the private sector needs to step up and to get more involved in wash systems and things like that. And I think what we're hearing is that the private sector, well, which is a very big thing. There's lots of different types of private sector, but we've heard different types in terms of service providers, in terms of microcredit, and they all have a role to play. But there kind of needs to be someone playing that kind of conductor role, like for an orchestra or a band or something like that, that helps bring all the different actors together in the right way at the right time. And that's where I think, yes, the private sector has an important role to play. And I think one of the comments earlier I thought was really powerful in terms of reframing people's thoughts around sanitation, of not just being a social good, a public service, but actually that it can be a market-based a component of that, which I think is really important of getting people to think about it. And then how do you bring those things together? So the role of government is really important, even if it's a private sector solution. So we've got a little bit more time for a few more questions. I think I'm just looking through. There was a question from Sam on who and what and on what basis funded the initial stock of the new sanitation products, the SATO, that you were introducing into the market. Maybe that's
Yeah, thank you, Sim, and thank you for someone who asked that question. I think the initial stock here, I want to mention something. When we are promoting access to improved sanitation, does not mean we are promoting SATO as a sole product. No, but this was one of the sanitation products. So we did not fund or pay for the initial stock. This was paid by sanitation entrepreneurs. So what we did, maybe in short, what we did was to create a sanitation supply chain. So we discussed with the Lixil to have first we discussed to have a plant here in Rwanda, which was not successful. But what Lixil did, they now they now had an MOU with a local entrepreneur or a local salesperson to have to set up how do I call it? He's the representative of Lixil or Sato here in Rwanda. So he's the national distributor of sanitation products here in Rwanda. Then from there, we established this sanitation center at the district level, community sanitation showrooms at the sector level, and sales agent. So what we did, the incentive we provided maybe is for the district sanitation center, where we sat together with the district to provide the building for the business, and then the private sector federation provided a sanitation operator on recruitment on the Yeah, they recruited a private operator. So the initial stock was paid by operators themselves. The project did not pay anything. It was just to facilitate that enabling environment. Thank you.
Yeah, great. And Sam, a question with these entrepreneurs and operators, are they just doing the sanitation products, or are they selling other services and products in?
Okay. Yeah. Yes. Thank you. At the sector level, those we call community sanitation showroom, which are more close to the community, they sell various products, even those extra sanitation. But for these sanitation centers, currently they are focusing on sanitation and hygiene products. But we did not limit them, just they can add some few products. But so far they have seen sanitation and hygiene as a business opportunity. They are now they have now invested only on that particularly, like 90% they are on of their product, their sanitation and hygiene products.
Right. And a question that's come in, why did you choose the Sato pan? It seems to need more volume of water to be cleaned. And how about decommissioning?
Uh, I think the reason why Satopan is coming frequently is that is the one that we mentioned in the statistic here. But when we're promoting improved sanitation, does not mean having a Satopan means improved sanitation. No, we're promoting sanitation technologies that separate people from their excreta. That means we have different technologies that do not have even Satopan, but that are qualified to be improved sanitation technologies. So currently we are developing a sanitation catalog, which will inventory. It is a stock inventory of all the sanitation products or technologies that we have improved, including also Satopan and Satostool, but including also other sanitation technologies that do not necessarily require Satopans. So I can give just one simple example is double pit latrines, which may have or not, but currently they have Satopan. But also I can mention like Tiger Worm toilet, which uses worms to eat shit and reduce and produce the compost. So they are various, but if you can manage to put a Sato on that toilet, it's better because it prevents flies from entering to the toilet or coming from the toilet to contaminate the community. Thank you.
Great, thank you. And a question for Bruce about for people with disabilities, what designs are available?
Yeah, thank you, Ashad. So first, maybe I want to clarify. So maybe there were confusion. People are like, we were the one to construct the toilet, or we were the one to sell. We did not sell anything. We built the capacity of the district sanitation center. We established the supply chain. We facilitated the establishment of sanitation showrooms close to communities, but everything was done by the private sector, by the entrepreneurs. So what we did was just to introduce low affordable technologies, low technologies, like the Satopan and the others. For the people with disabilities, I'm sure you see one of the slides with the toilet seat that we've introduced for elderly people and people with disability. Those ones were introduced as a matter of showing these are some of low available toilets that can be adapted for people with disability and other people. We introduced them as a show up, as an exhibition, but we want the private sector, the private operators, the entrepreneurs to roll them out so that they can continue the production and the supply chain. And at the end, the toilet reach to everyone. For the poor people, I also saw someone asked about the poor people. Our project, as Nikes mentioned, did not work through a handout donation. We did not donate doors or tiles or sheet or to build a toilet. Rather, we demonstrated, we build the capacity of the masons, of the local masons, how a toilet can be built, and then the choice will be for the person and will be linked with the masons and the district sanitation centers. However, the government has a poor or eradication or poverty fighting systems where we show them that they even have a human security initiative or program where they pay for the basic needs for the poor people and upgrade them, moving from one level to another level in a wider program to fight poverty in the country. So for all those mechanisms, all the interventions around sanitations were mainly based from the prototype or the technologies. For example, if the government was to construct a toilet or improve a toilet for a poor people, they will go through the district sanitation center or work with the community members or the masons and improve the toilet for that poor people without necessary interventions, because our market-based approach was not really designed for poor people, but it's because we know the government has an overall, a bigger, a wider program to fight poverty, and they have used our toilet prototype technologies to improve sanitation for poor people. Thank you.
Great, thank you. Well, I think we're just about at time now. So I think my last question to you, Bruce, as the leader of this project that's just coming to an end, is a bit more existential, I guess, in that what you've shown is that NGOs aren't needed to deliver sanitation. It's not about handouts. It's not about those kind of aids. What NGOs like you guys can do is that facilitation role, that orchestration role. The question is that without that kind of aid funding that we've had previously, how does this continue in this new world? Is there a kind of a business model for the type of system strengthening work that you've been doing over the last 5 years so that it can continue? Is it about government stepping up? Is it about philanthropy? Or is there another way that really great work, system strengthening like this work, can not just continue in Rwanda, but that other countries can also go, yeah, we can do this as well?
I think my simple message will be, all those people, philanthropy, government, working together through one common objective: go for business, because business will stay forever. If WASH entrepreneurs can go through a business approach, you've seen commercial banks now coming in, which is something they have never thought, that there's a business in water and sanitation. You can see entrepreneurs, you can see the private sector federation at the national level, learning selling techniques on latrines from dicky selling. So those are small initiatives that, when combined together, are proof that water and sanitation business model are feasible. I'm sure we can have another webinar on pit emptying services. We've had pit emptying people who've started with wheelbarrows emptying, and now they have 4 trucks to empty toilets. They are now going stronger. They are building, they are purchasing more trucks. All of that due to this small mechanism of establishing small commercial loans with low interest that people can afford. So maybe in the interest of time, I will go. Let's go for business.
Fantastic. Great. Well, thank you to Bruce and the whole team, because we had some great presenters, but also behind that, you'll have seen in the Q&A there was a whole team answering questions as well. So just thank you to the whole team and to you as an audience for coming and being so actively engaged in this topic, which is for the rural water supply network. Maybe is not our core thing, but it's all about looking around at what other sectors and being part of the WASH sector family. So thank you for participating. The presentations are already available on the website. The recording will be published on our Vimeo channel. And just a final thing is that this is part of a series of webinars that we're running at the moment, the early series. And so tomorrow, in fact, there will be a webinar that we are doing jointly with the International Association of Hydrogeologists. as part of the UN Water expert group on groundwater. So please do join us for that one tomorrow. And then next week we have another webinar with Water for People, focusing on water loss and turning that into an opportunity for non-revenue water. So that's great. And then on the 9th of June, we have a Data for Action, a theme webinar on how countries are using their WASH data, which is great. And then finally, the end of June, we have a Stop the Rot webinar on making connections to improve infrastructure quality. So please do register for those and join us then. But otherwise, thank you so much for joining today. I hope you've enjoyed it and found it useful. Please do stay in touch and join the forums and comment and share on LinkedIn and Facebook and our other platforms. Please do fill in the survey form after this. Give us your feedback, what you liked, what you think we can improve, and see you next time.